most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In their opinion, of course, Bob.
Do they really think they're the most famous?
Yeah, Bob, they are aware that we are the most famous, in our opinion.
Okay, in our opinion. Today we're going to talk about how to apply kinesiology taping for knee pain. Now this is good for Patella Tendonitis, Patella Femoral pain, and really just generalized pain too.
Sure.
So I got it from an expert. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, if you get a chance, go to bobandbrad.com. Go to the giveaway section.
That's right.
Because we're giving away a mattress, right?
Is it a mattress?
Yeah.
Yes, Tanner said yes.
So a mattress, beautiful mattress.
Sleepovation, yes, we love them.
Good for pain relief. You can also find the contest on Facebook. And you can go to Twitter, Instagram, or TikTok for a 60-second version of our program.
And the podcasts are out and running, and we've got this gentleman on a podcast. Correct?
Speaking of which, I had John Gibbons on the podcast.
Yes.
Very prolific author.
Oh, nice word, Bob.
Yeah, thanks.
You must have been up last night with
the
thesaurus.
Yeah, that's right. So one of his books is on kinesio tape.
Mm-hmm.
And when I have him on the podcast, I ask him, what are the three syndromes you used the tape for that it worked the best?
Mm-hmm.
And one was the knee,
mm-hmm.
and one was the foot, and one was the elbow, I believe it was.
Memory issues, huh,
yeah,
Bob?
Yeah.
But this gentleman, he's been taping for over 20 years.
Yeah.
And he works with high-level athletes.
One of the founders kind of it. Kind of was really quick into it.
Yeah.
I mean,
I read his book and I was very intrigued by it. And it's a nice book if you want to tape yourself and you want to get some,
Right. And he admits, how much is placebo, how much is real. But he says he really has good luck with it.
Yeah.
And he says it's not going to cure you. I mean, what it does is it knocks your pain down. So then you can go after the real problems. Like, let's say it's weak.
Mm-hmm.
You can then strengthen it.
Sure.
Let's say you're having trouble. Again, he always talks about you want to look above and below. So is there something going on at your ankle that's causing you knee pain?
Sure.
Is there something causing at your hip that's causing you knee pain?
Yep.
It's the weakest link.
He must be a physical therapist.
He must be a physical therapist. So, Brad, we're going to do it on you.
Oh, good.
So, why don't you lie down and lie down flat?
Lie. L-I-E.
Lie flat, yes.
Yeah.
I cut 2 longer strips here, and I cut a shorter strip, which they call an I strip.
I.
Yeah.
The letter I, or?
I'm sure it's the letter I, right?
Yeah, okay. I know what you mean. It's in the book.
Yeah.
I distinctly remember that part.
Okay, why don't you lie down?
Yeah, put the scissors down. Good.
Yeah, you don't trust me, huh?
So we're going to do the right knee?
Right knee,
okay.
And you want it bent to right angle.
So is this, well, we'll see how this goes. Is this something that you could do to yourself or you need help?
Yes, absolutely. You
okay.
can do it yourself. And you probably, you're going to get a little hair here, Brad, and you wouldn't want to clean the surface before.
You may want to shave to get the, because it holds with the hair on it, but maybe not as good.
Well, it's not pleasant to take it off.
Take it off is not, but some people, if they're, what is it, the masochistic, may enjoy that, or sadistic, I don't remember.
It's masochistic.
Okay.
Yeah. Okay, so we're going to put the first piece, about 4 inches long, right across the patellar tendon here, Brad. So what you do is you split it in half like this. By the way, I used rock tape.
Mm-hmm.
It's called rock. It's a brand. It's the one he recommended.
Yep.
You can use other types without a doubt, but the only thing I'm concerned about with those is you want to make sure the quality is a decent quality.
Yep.
There's some cheap ones that I wouldn't go that route. I would go a little bit more. So this one, he's supposed to do this has stretch to it. And he wants 100% stretch on this one.
Yep.
So you're stretching as far as you can. You don't stretch the ends. The ends have no stretch to them.
And that allows it to adhere better to the skin so it doesn't peel up.
Right.
Mm-hmm.
So I'm going to go right across the tendon. I got 100% stretch. And then I pull the end off here and I just fix that. And I fix that. Then I take the back of this and I warm it up and make it even more fixed.
So you rub on it.
Yep, you rub on it.
Doesn't he give a time on there or no?
No, he
Okay.
just does a few.
I've read other things where they say up to 30 seconds you rub on it to get it to so I don't know.
Okay. Now on this one, I'm going to tear a little piece off at the end because I want to. Again, that's the area where there'll be no stretch. On the ends.
Yep, I know what you mean.
So, were you saying something else, Brad?
Well, yeah, if you just pull this and rip it like that, it comes off pretty easy. If you try to peel it, it'll drive you nuts, and you don't have to do that.
What did I do wrong?
Well, you just gotta pull. Like if you want to get the end off, just pull it, rip it, and get it all the way
that's what I was
across,
trying to do.
and then just peel it off like that.
So the first part is gonna. Should I take that one first?
Sure.
The first part, you're gonna actually go up to the top of the knee into the quad. So I'm affixing that, no stretch.
Yep.
And then I'm going to take half of it off. And with this one, you're actually going to shoot for. Now I'm only going from here. It's only going from here to here. So I'm going to go 100% stretch.
So you pull it till it stops stretching?
Yep,
Okay.
but then I'm going to go 50% of that.
Okay.
And 50% of that. So only going 25%.
Okay.
Yeah.
Yep.
So I'm going to fix it right here. And then I'm going to do this, Brad.
Yeah.
I did do that already. You did do that. Thanks. I'm going to hold it here. Now I'm going to go to the end.
Yeah. There's a little learning curve with working with the tape. Mm-hmm.
So now I'm going to do 100% stretch.
Okay.
And then down to 50.
Okay.
He wants the lower one at more. So I'm going to cross the lower part here.
Yep.
I'm going to take it off, and I'm going to affix this one again. No stretch on the end.
Well, that's really covering a lot of.
Now I see him do it different ways. We're going to do one strip here too, but I've seen him also then start below and go above after he's done this one. So he has actually 4 pieces of tape.
Sure.
So he's done it this way without the 4 pieces. So I would try that first, as opposed to.
And I think in the book he gives you some information about.
Yeah, in the book, again, did I mention the title? A Practical Guide Kinesiology Taping.
Yeah, I'll show him.
Oh,
I dropped my pillow, Bob. Now I'm not going to be as comfortable. There's the book. Yeah, look at him. He looks like a young man yet. He looks like he's only about 40, 50 years old.
Now he was like you, Brad. He started off in a different field. And so I'm going to pull.
Yep.
100%, 50%, 25%.
Yep. So just a little bit of snug there. Yep.
Bring this off. And I'm going to grab right here. 100%. Down to 50%. I made this longer than it needed to be.
That's all right. This is one of those things too. It looks good when you're out with your buddies. They look at this tape and they're envious.
There you go, Brad. You're not going to have any knee pain now. So again, generalized knee pain, patella femoral pain, patella tendonitis.
So this is not. Oh, we got there. That's right. I forgot about that.
Yeah, and when you straighten, you start seeing it wrinkling up, which is that the idea. It's supposed to lift.
So it looks like an old man knee, wrinkled up there. But that's good.
That's good.
What he's saying.
Right.
Okay.
That's helping the lymphatic flow.
Then that makes a lot of sense because the lymph it flows just below the surface of the skin. So I mean that part to me makes a lot of sense. Look at that.
Now again, this is going to probably bite a little bit on Brad when you take them off because they're hairy.
Oh, Bob, I'm tough. I can take it.
Yeah, okay.
I'm not going to do it in front of the camera.
I was going to say we don't want to have you cry in front of everybody.
Now,
so
I'm going to do an event this weekend. Maybe I should leave it on.
Yeah, Brad, why don't you talk? You've been doing it on your hamstring. How long have you been able to keep it on?
Well, this is with the rock tape. I've used the other tape before, but so I did this Monday. My hams were I've had in the spring earlier problems, and it just tweaked recently, and I got a triathlon to do this weekend, so I'm going to just tape it for a maintenance or kind of a PM thing.
Sure.
I put it on Monday. Of course, I take a shower every day, and I swam Tuesday in the pool, chlorine pool, Tuesday and this morning, and it's still holding up, so this is the 4th day.
And
it's,
that's the whole idea about getting some quality tape.
yeah,
I mean,
that it
and
stays.
normal athletic tape, you'd be lucky if you get out the door with it on sometimes.
Well, it doesn't
before-
stretch anyway.
Yeah, it doesn't stretch.
It doesn't do it. But yeah, if you get, I think it's like a lot of things, you get what you pay for. But this clearly it comes in a really good quality container.
Yeah, it does. Oh,
Oh,
that's not it.
wrong one. Oh, we lost it.
Yeah.
Anyways,
Um,
so yeah, but the other stuff I've used held up long too, and I don't remember what brand it is. So you can, if you don't get rock tape and you get something
right.
else,
I
see what
generally-
happens.
Generally, I think if you spend a little more, it's going to
Yep.
a little more.
it's pretty.
I wish I would have started using this with Patella Femoral syndrome, and where you pull the kneecap over.
Oh yeah,
Because that tape would always
Yep, pop loose.
pop loose.
Yep.
Always. And this would have worked really well for that.
Yep.
So-
I think when you have a notable guy like this guy, he wouldn't recommend it if he didn't use it
No,
himself.
willy-nilly. And I mean, he's worked with Olympic athletes and
Right,
I
right.
mean, he's the guy. He's a very good clinician.
Yeah.
Very good. So
You
all
could
right.
just tell when you talk to him.
yep,
He's a good guy.
yep. He's a good
he's-
guy, and he wants people to get better.
Right.
So
So good. Thanks,
and so
Bob.
do we. All
Oh,
right.
that's right. We do too.
Remember, Brad and I can fix just about anything.
Except
A
for
broken heart.
yes, and we're going to continue, and maybe a little kinesio tape, a crisscross here, would kind
A
of
lot of
do
times, I
something
think
for
if
that
you
broken
kept
heart.
your mouth shut, you probably wouldn't get a broken heart.
Only for the guys.
Yeah, only for the guys. All right,
Take care.
thanks.
Be careful.